Welcome back, everyone. Next up, we have Vivos Therapeutics, Inc. It trades on the NASDAQ under the symbol VVOS and is a medical technology company focused on developing and commercializing innovative diagnostic and treatment methods for patients suffering from breathing and sleep issues arising from certain dentofacial abnormalities, such as mild to moderate obstructive sleep apnea and snoring in adults. The Vivos Method represents the first clinically effective, non-surgical, non-invasive, non-pharmaceutical, and cost-effective solution for treating mild to moderate OSA. Happy to bring on the CEO, Kirk Huntsman. Thank you for joining us on our conference today, Kirk. Very excited to hear about this technology and send it over to my father. He could really use this.
All right. Well, thank you, Anna, and I appreciate the opportunity to be here.
Great. Take it away and call me back when you're ready for questions.
All right, will do. Thank you and welcome everybody. My name is Kirk Huntsman. I'm the co-founder and CEO of Vivos Therapeutics. As Anna mentioned, we are listed and trade on the NASDAQ under the trading symbol VVOS. We are, as she mentioned, a medical device company. I'm going to just go through, this is the legal disclaimers. This presentation will be posted on our website after this conference is over, after this call is over. So you can feel free to go to vivos.com where you can find this under our investor relations page. So as Anna was saying, we are a medical technology company that is revolutionizing the treatment of breathing-related sleep disorders, including mild to moderate obstructive sleep apnea. By way of reference, we have a network in North America and actually providers now around the world, but mostly concentrated in the United States and Canada. We have approaching 1,700 trained clinicians in the United States and Canada. We have treated over 31,000 patients so far successfully with our treatment modalities. And interestingly, we have the ability to treat over 85% of patients, of all OSA patients. So it's not limited to a very narrow slice of the overarching sleep disorder pie. We actually have the ability to treat a broad segment of that population. Just to give you a sense of the total addressable market that we're talking about here, many people don't realize just how pervasive breathing and sleep disorders are, but there's over 1 billion people worldwide that suffer from OSA. That's about 1 out of 7 people that are walking around here on planet Earth. And well over 80% of those are undiagnosed and untreated. And the problem with OSA is it's not just another in a laundry list of chronic health conditions, but the challenge with obstructive sleep apnea is that it affects so many other vital functions of our body. The Mayo Clinic came out not too long ago and said that obstructive sleep apnea was not just comorbid with cardiovascular disease, but it causes cardiovascular disease. The American Heart Association recently added sleep to as one of its pillars of health for addressing cardiovascular conditions. So we're talking about mental health issues, depression, anxiety, Alzheimer's, dementia. We're talking about fibromyalgia, heart disease, cancer, all sorts of different conditions that plague modern man are all comorbid with or caused by, to some degree, obstructive sleep apnea. So what happens when we fix OSA? Well, we now know, and this is a recent study that was just published, we now know that all-cause mortality declines, cardiovascular mortality declines significantly. You can just see down the list here of all the different conditions that are impacted and for the better when we fix obstructive sleep apnea. So there's no question but that there's a societal benefit to this. There's a compelling personal health benefit to fixing obstructive sleep apnea. And the American economy alone, and it depends on which survey or which analysis you look at, depending on the core assumptions, but it's between $100 and $300 billion annually could be saved throughout the American economy if we just address this condition. Now, the gold standard for treatment of obstructive sleep apnea is, of course, is the CPAP unit, the continuous positive airway pressure device that everybody's familiar with and is universally loathed and hated by patients who have to wear it. Unfortunately, most of the patients that are given the CPAP unit will abandon it eventually. Typically, it lasts for maybe 6 months or even less in some cases. And there are some patients whose condition of sleep apnea is just not conducive to CPAP. They can't tolerate the device. They become claustrophobic, or they have a blockage in their upper airway that precludes this. There's several different reasons why patients may not be able to tolerate their CPAP. Excuse me. So how does medicine fail obstructive sleep apnea patients? Well, the first way is through diagnosis. The diagnosis for obstructive sleep apnea, the process itself is cumbersome and expensive. The traditional way of dealing with this is to send a patient for a polysomnogram, which is the in-lab overnight sleep test. Those are expensive. Excuse me. Those are expensive, and they pose, there's certain barriers that are put up there by payers and providers because it's a costly way to get a diagnosis going and get a clear and definitive diagnosis of obstructive sleep apnea. So the diagnosis part of the equation has been a challenge traditionally for patients and for providers who are trying to figure out what's happening with their patient. The other challenge is treatment. The options for a patient that's diagnosed with sleep apnea are limited, and they're mostly undesirable. CPAP, again, is prescribed for over 90% of the patients. And again, over half of those patients stop use within the first few months. Surgical options that are out there, whether it's neurostimulation implants or some other more dramatic type of surgery, are just not very appealing to patients, and so they really don't like them. Vivos is really in a unique position of addressing with a very sophisticated and unique technology both of these limitations and really in a very elegant way. The first way is through our diagnostic model, where we actually deploy a technology from a company right here in Colorado called Sleep Image. The Sleep Image rings, actually, they're FDA cleared for both children and adults. They correspond up to 98.6% within a polysomnogram, so that this little ring can be worn comfortably in a person's own home or used by a child very, very safely, very comfortably in their own bed. And they can get a readout that is very, very closely tied to the full-on polysomnogram, and the cost is less than $10. So the cost has been reduced from a sleep lab test of around $2,000 to under $10 for this test. But it's equally effective for actually diagnosing the condition and any other ancillary things about a patient's sleep patterns. When you think about treatment, Vivos stacks up really well compared to CPAP, traditional oral appliance therapy, and things like Inspire Medical or surgical procedures that are invasive and pose certain surgical and other kinds of risks. Vivos is cost-effective. Vivos has a potential lifetime benefit. There's also cosmetic improvements that happen when somebody goes through Vivos treatment. The cost for our service to the patients is usually $8,000 to $12,000, and the risks are very, very minor. They're very, very, our devices, our oral appliances are very comfortably worn, and we compete very well when you think about the overall cost of a CPAP over time, or oral appliance therapy, traditional oral appliance therapy over time. So we have a very unique position in the marketplace that we're actually broadening out, and we're working closely with DME companies now that are the purveyors of CPAP units and the distributors of CPAP units. We're working closely with those folks. We're working closely with sleep labs and others who have CPAP failure patients. We're working closely with, we have an expanded product line here where we're actually including other kinds of oral appliances to meet certain price points. So we have a very comprehensive approach to this condition and to meeting the needs of providers who have a wide range of patients that they're trying to deal with and that they're trying to find solutions for. Patients who go through our treatment, our key FDA-cleared treatment, 97% say they achieve their clinical objectives. In most instances, about half of those patients will see their OSA completely resolve. And I'm going to show you a video here in a moment as to why and how that takes place. 98% of patients would gladly refer a friend or family member. There's no lifetime intervention required. There's no pain. There's very few or minor risks or discomfort. It's covered by medical insurance. It's Medicare approved, and it's FDA cleared to treat mild to moderate sleep apnea. Just to give you a sense here of what some of our devices look like. These are oral appliances. As you can see, there's a full product line. Above the line are our product lines here. And we're talking about FDA cleared, our DNA appliance, which is the most recent FDA clearance. Our other products have also received FDA clearances for treating mild to moderate sleep apnea. The interesting thing about the DNA appliance is that it's the very first time in history that an oral appliance device has been cleared by FDA for a mechanism of action that does not involve mandibular advancement. All other oral appliances on the market today involve some type of mandibular advancement. It's a mechanical repositioning of the lower jaw. Our DNA appliance demonstrated to the satisfaction of FDA that and other regulatory agencies around the world that our mechanism of action, which is unique and patented and proprietary to us, is really something that is effective and that works well to reduce these symptoms. The lower row constitutes some pediatric products that we have, some other mandibular advancement devices that we have, some expansion devices. And then below the line, we have a series of services that we use and that we deploy to support the doctors who are trained in this. So the Vivos Institute, where I'm at today, is actually one of the world's leading institutes for training providers in the treatment of breathing and breathing-related sleep disorders. And then the Aero 2, for example, is a full SaaS practice management platform, and it allows for dentists and physicians to file the claims that are necessary for medical insurance coverage. All these devices, for the most part, they'll receive some level of insurance reimbursement, and that depends on the provider and the policy and several other things. But this is our product and services suite that we deliver to our providers nationwide and around the world. Next, I wanted to review our revenue model just a little bit. Those of you who are familiar with Invisalign are going to be familiar with this. Invisalign and Align technology actually has a model that we replicated here because the dental industry in particular is used to that. So we manufacture at X, we mark it up and sell the appliances to the dentists for Y, and they mark them up again. And with their service component, they actually then, the patient pays the retail. Insurance will help offset most of the costs. And so that's really the level of that's the sort of the economic ladder as we go to market. We do have a training and services bucket for all the training that we support and supply to the profession. And it's not just dentistry. We're getting medical doctors in here now, more and more. We're getting chiropractors. We're getting other providers in here from various disciplines around the world, and people coming in from all over the world to be here. I'm going to show you now what our appliances do. This is a 30-year-old male. You can see on the left the before treatment image. This is a cone beam computerized tomography X-ray, and then you have the image taken with the same the same patient after 14 months. Again, before treatment, this individual had severe sleep apnea. After treatment, his sleep apnea was essentially gone. And his airway, with no appliance in the mouth, no device, no artificial intervention here, his airway volume has doubled and his airway size has tripled. And so if I could have the little video queued up now, that'll be good. You guys can watch this video. All right, so that gives you a sense of really what's going on inside when a patient, over the course of between 12 and 18 months, as they wear our devices, their airways change. This is the progressive image of a young woman who had graduated dental school. That's her on the left in 2011. And then the progression, once she began treating herself with our technology, you can see the facial changes. Her whole health profile became so much better. She lost the big gummy smile there because we actually reposition the tissues of the oral cavity and some of the craniofacial bones, the jaws, that actually allow for a more pleasant cosmetic look. And this is her. So she went into treatment in 2011. She finished in early 2013. And this is her. I think this picture was taken in 2021, 2022. But her airway basically looked like this. In 2011, she had a constricted airway. You can see the side profile there on the far left. And then you see the frontal look at that. And then you see how that had gotten thicker in both dimensions in 2013. And then when treatment was stopped, her airway continued to stay the same. So she's not had any intervention since 2013. As she's walking around today, her airway is open and patent. Here's a look down from the top. You can see her teeth. You can see how much whiter her palate is today. And you can see that after we stopped treatment, because of the continuing pressure of her tongue that was able to now get up in the mouth where it's supposed to be, her airway continued to expand and grow. So we have a lot of patients continue to get better even after they stop treatment. This is another one of our patients. She happens to be an employee here. In late 2017, her husband died of a massive heart attack. And in the coroner's report, it was due to obstructive sleep apnea. She came to work for us in early 2018 and got tested and saw that she had, as a new widow, she had an HI of 52, which is severe sleep apnea. Just 7 months later, in November of 2018, then she had virtually gone to mild sleep apnea, and eventually in 2020, she stopped treatment. And today in 2021, and still today, to this very day, she's got no sleep apnea there. Our opportunities here at Vivos are compelling. We're setting up nationwide distributors with various entities to distribute our guides to the providers that are going to treat these patients or who have CPAP failure patients. There's a large number of dental groups. We've talked about this many times. The DSOs that are corporate dental groups in the US and Canada, we're in pilot tests with a number of them. Those pilot tests are going extremely well, and we're continuing to expand our footprint in that particular market segment. Large employers, we're just now starting to get into this, but we're seeing more and more large employers, unions, and medical insurance payers that are realizing what we have to offer and are looking at incorporating this into their insurance plans and into their payment schedules. We've expanded our product line to meet broader needs at all price points. We have established something we call Treatment Navigator to implement and execute the real patient journey with distributors and DSOs. And then we actually have the Treatment Navigator pulling patients through to completion It's a very successful program. We're excited about what that's going to mean. Our growth drivers at this point in the company, our pilot tests are going really well. They're showing huge potential for both DSOs and the distributors that we're talking to. These are people that have lots of CPAP patients, lots of CPAP failures, and we're excited about the conversations and discussions that we're having with them to get basically these patients that have tried a technique, tried a device, a CPAP device or whatever, and it's not worked, as an alternative treatment before they just get lost in the system. We're going to be able to put these people into some of our Vivos appliances and get them better. As I mentioned, our treatment navigator program, our revamped product and services offerings, and our medical dental partnerships, which are really starting to be exciting. We have some of our medical dental partnerships that are unprecedented as far as we know throughout medicine and dentistry, doing really well, especially out in California, down in the Southwest, and here in Colorado. We're excited about the way that those things are driving, and the way that medical doctors are now referring their patients for frontline treatment in Vivos. All of that is growing really well. It's positioning Vivos for long-term revenue growth and profitability. And we've also had a very strong initiative here on achieving positive cash flow through cost reductions and revenue initiatives. We've talked about the revenue initiatives, probably not emphasized enough just how much we've pared back our burn rate and really look to be getting to a point where we can be cash flow positive in the next 12 to 18 months. And we're very, very committed to that and are moving aggressively in that direction. Here's some summary financial information. Rather than go through this in any detail, I'm going to go ahead and let you read this. This is from the third quarter. We haven't reported, of course. We haven't filed our 10K yet. That'll be coming up shortly. Just a little note about our management team. All of these people have got extensive industry experience in both dentistry, medicine, and the sales and marketing part of this thing. We're excited about the management team that we've got here. We're excited about our board of directors, people with extensive industry, government, and other kinds of experience, and our medical and clinical advisory board. Some of these people are some of the top people in the world in sleep medicine and research, and we're excited to have them as part of our team. And that's it. So thank you very much. And Anna, I'm ready to take some questions. If you have some questions for me from the audience, we can do that in the time remaining.
We do, Kirk. All right. Let's start with talking about your competitive landscape and how you plan to dominate in this area.
Yeah, so thank you. So we, if I could just go back to this slide right here, I want to talk about the DSO marketplace is a very, very large, that's dental services organizations. There are over 40,000 dental offices throughout the United States and up into Canada that are owned by these large corporate groups. I was actually one of the founders of that entire industry. And so we know our way around with those groups, and they are really searching for other product lines to take in. Sleep and treating sleep and breathing disorders is something that they find really attractive, very appealing. There's better margins in that business than there are in other forms of general dentistry. So they're very excited about that. Our pilot tests are going really well. We're excited about what's going on. We're seeing a large amount of interest there. And then we have these distributors that we've been setting up that have large numbers of failed CPAP patients that we are continuing to see interest from these distributors in saying, okay, so we've got all these thousands and tens of thousands of CPAP failures. What can we do through Vivos that's going to give these people some relief? They obviously can't use CPAP. And now we represent the next best option. We're the only company that has a network of sleep practitioners with dental oral appliance specific training in the world. And so it gives us a real leg up on any sort of competition and huge amounts of opportunity for driving growth in the future.
Fantastic answer. We have a question from Henry. He says, my dentist and friends and family have not heard of Vivos. So how are you advertising? And further, I have not seen it on social media. So do you plan on ramping this up? Also, do you think it'll be necessary to compete with Transpire or any other apnea product?
That's a multifaceted question. Let me see if I can address the first ones first. So the first phase of our go-to-market strategy necessarily entailed getting a network together of doctors that were trained up in how to do this. This is not something that dentists learn in dental school. And so we had to basically recruit, train, and establish this network across North America. That is largely done to our satisfaction. A patient virtually anywhere in the United States or Canada can find access to a Vivos trained provider, and within a 20 to 30 minute, maybe 40-minute drive, they can be to a clinician well-trained and suited for doing this. We've pivoted over to going after going after patients and getting patients involved here. This is really a focal point of us now. We've been at this for about a year, and we've had to learn a few things about how to do the social media. The people that we had initially, we were very disappointed in. We've replaced them now. We've got these new distributors coming online, and they have immediate access to, as I mentioned, tens of thousands of patients that have this condition. So I think you're going to be seeing more and more of that in social media and, excuse me, through other channels. And as far as our competitive approach or competitive position relative to Inspire, I think you said Transpire, it's actually Inspire Medical Systems. And Inspire is a neurostimulation device that's implanted in the chest cavity, and they wire up the back of your tongue and they wire up your diaphragm. It's an invasive procedure. It's very expensive. It's driven totally by insurance. We think that when the payers wake up and realize how much money they can save by intervening with Vivos prior to putting that in patients' mouths, or patients' bodies, we think we're going to have a very, very strong competitive advantage over the purveyors of Inspire medical devices and neurostimulation or other types of devices. We don't see our products replacing CPAP machines in the near term, but we do see where we work in a complementary fashion with the purveyors of CPAP. To some patients will get off their CPAP machines. Some of them will just be better able to tolerate their CPAP and have a better experience overall.
Great. Thank you for that answer. Adam Galloway wants you to address any risks associated with your products or the procedures.
That's one of the great benefits of our procedures, is extremely low risk. When we had to define for the FDA what are the risks associated with this, it was basically drooling and minor tooth movement. So when you put anything in your mouth, the body responds, and it for about the first week or so, there's excess saliva that's secreted, and so there's a little bit of excess saliva. There's also some minor tooth movement that goes on as we rebuild the oral cavity, but there's not any kind of really contraindication by way of some sort of strong risk factor. This is very low risk. It's very easy to wear. The appliances are very comfortable to wear. And you mentioned your father. We have all the time. We're taking patients all the time at all different ages, from children to our elderly population, and we're helping them either tolerate their CPAP better or get off the CPAP altogether and get into a state where they really have a new lease on life.
Fantastic. So Jay Roberts wants to know, does insurance cover the Vivos procedure?
It does. And like I said, it depends on the type of insurance policy, depends on the carrier themselves. But generally speaking, about half the cost will be borne by the insurance provider, and about half the cost will be paid out of pocket by the patient. So it's similar to an orthodontic case. If you think about an orthodontic procedure, patients pay for those all the time, and the treatment is 18 to 24 months. It's very similar in terms of how our model works here at Vivos.
Great. Darren Swick wants to know, what are your plans to possibly focus on severe OSA in the future?
Well, our providers treat OSA off-label using our devices all the time. We, as a manufacturer, we're only cleared to discuss mild to moderate sleep apnea, but there's really not anything, there's not anything inherent in severe sleep apnea. And in fact, our next line of conversations with the FDA is to get them to allow us to say, as an indication of use, that we can treat severe sleep apnea. Today, Vivos providers do treat severe sleep apnea off-label.
And Armando asks, is your treatment a one-time fee?
Typically, the dentists and providers out there set the fees. We don't set the fees, but it's typically a one-time fee. And the treatment, you wear these devices in the evening hours and overnight, and then you go for. We've had patients resolve in as little as 9 months, and we've had patients take up to 2 years. But it really depends on how diligent you are with your compliance and wearing the device every night, as indicated, and also just individual biology and differences between human bodies. But it's a one-time fee typically, and a lot of times there's patient financing available for patients who need that to help afford the treatment.
Alan Gold asks, what is the difference in cost across your products? And do any of them have recurring revenue?
Oh, yeah. The recurring revenue model is the same as Align Technology. So you train the providers have the patients take the treatment, and the providers every month when they order back from us. So it's a recurring revenue model all the way through. Plus the providers pay for ongoing continuing education, which we provide here at the Institute. So there's lots of different ways. There's the medical billing service that we provide is another revenue stream. So lots of recurring revenue. And what was the other part of that question?
It was, that was it. The difference in cost across your products.
Yeah. So this is the new thing that we did. We used to be a little bit binary in that we had some very expensive training with very expensive products. Now we've lowered the cost of all that, and we have a product line that could suit just about any kind of demographic. So if this is a Medicare population demographic, we've got products that will serve that population. If it's a pediatric population, we've got products that will help with the pediatric population. If it's whatever the price point is, from anywhere from, let's say, a low of probably $1,500 to $2,000 up to a high of maybe $10,000 for the complete airway remodeling that our more sophisticated appliances can do. That's so we can handle what anybody's clinical objective is. We've got a product and a price point that'll meet their needs.
Perfect. A follow-up with that, what does the recurring business from your providers look like? Are there orders repeating and growing? Adrian Fields asks.
Oh, absolutely. We actually just in January here last month, we had a all-time record month with recurring sales, and we're training more and more doctors all the time, and the level of production of our providers is going way up. We had a provider just last month that did 70 case starts. So we have that. If you do the math on that, it's a lot of money. But there's a lot more referrals. Almost all those referrals were coming through medical doctors that were referring to this provider. So we're seeing a real uptick in production as the medical community starts realizing what's happening and what this technology can do, and is referring patients in. So we're excited about the recurring revenue streams that we have as we grow this business.
Richard Handke said he had to order your investor deck online, which is fine. How long until he can expect to receive the deck in an email?
Well, I tell you what, we're going to put this out on our website today. If there's an order process, I'm not exactly sure how that goes. So if there's an order process, we'll try to make sure we get those out immediately. So we'll try to deliver within 24 hours, get the links out there, get them posted, make sure that everybody has access to our deck.
Great. And last question from Vic Kaitan. What do you expect revenues to grow over the next 2 years? And at what level will you be cash flow positive?
Well, I can speak to the last part and say that we are aggressively, we've eliminated a ton of costs in this company. We've had staffing reductions. We've had We've lowered our operating overhead and expenses in a drive to get our cash flow consistent with our revenue streams. And so I think what we're looking at is in the next 12 to 18 months, we expect to be cash flow positive, and we may need to do another capital raise. But I think right now we're feeling really good about where we are. We had a capital raise in January. We feel good about how far that'll take us. We're looking at some other opportunities, but we're feeling very good about our prospects this year for growth. We don't give guidance out, so all I can tell you is that I've been at this now for 6 years. I've never felt better about our near-term and midterm growth prospects because of some of the relationships that it's taken us a long time to develop and foster. All those are starting to come to fruition. We're very excited about our prospects for the remainder of 2023, and I would expect cash flow positive by early 2024, if not sooner.
Fantastic. Well, thank you for your time and presentation, Kirk. This is really important stuff you're doing here. We appreciate you being on our conference.
Good, Anna. Thank you for having me.
All right, everyone, stay with us. We'll be back at 2:30 Eastern Standard Time with our next presenters. Thanks for watching. We'll be right back.